And the patients are grateful.
And that is probably the reason I went into glaucoma, is because the patients are grateful.
Yeah.
They, in my opinion, probably have one of the most severe eye diseases that you can possibly have.
Yeah.
But they're the ones who are the most loyal. They're the most grateful for what you're trying to do for them. They know that you'll never make them better per se, but they are so thankful that you're trying to prevent them from getting worse. And I love the patients, and that's why I did it. That's really why I did it.
And you bring in, I guess, fresh blood is a cliche, but you probably bring in a perspective that complements their years of experience.
I agree. I mean, I think that I was looking for somewhere that had that level of experience a bit, and I wanted somebody that I can continue to learn with. But what was most special, I think, about this place is that they weren't looking for somebody to just teach, but they were looking for somebody to teach them. So our senior partner's been here 31 years now, but he is constantly asking questions of people who are not born when he started to practice. And he is interested in what I have to say and why I have to say it, and that's what makes him great, and that's what makes this practice great. It's just you don't see that very often.
Yeah, it is an amazing practice. Is there a particular reason you got into this field?
Again, I mean, I think there was probably two reasons. One of them I've mentioned, which is that the patients are awesome. Patients are grateful, they're kind, and they know that they have a problem, and they know that you're trying to fix it. And you develop a very special relationship as a result of that. And I don't think you necessarily get that in all of medicine, but in ophthalmology, and specific in glaucoma, I think you really do. And the other reason was, to be quite honest, I never thought I'd do glaucoma. I thought it was one disease that affected one set of people, a bunch of old people who got it, and there's one way to treat it, just lower the pressure. But while I was in training, the patients that I would stand around talking about with my co-residents day in and day out at the end of clinic were the glaucoma patients. Because every patient's a kind of little bit of a different project, and every patient's a little bit different, and you need to treat everybody as an individual. And I know that's true for all of medicine, but for glaucoma especially, I tell my patients all the time, you can have high pressures and never develop glaucoma, and have low pressures and have glaucoma. And if we think that glaucoma is all related to pressure, how's that possible? And so I think it makes it fun for me, it makes it fun for the patient. We can work together to see what works best for them. And even if two patients have identical diseases that are acting identically, the personality of the patient and the personality of the physician and the skill set we bring to the table are different. And that is what's going to dictate their care. And I think that's really fascinating. I think that the emotional aspect of it is very fascinating to me.
That's great. You all are so articulate. I'm just
Hardly.
amazed.
Hardly.
No, you are. You are. I know you're the new kid on the block here. Let me move. Can you move it just a little closer? Has there been a particular situation you have been proud of? Something you did or a reaction by a patient that you can take us back to and share that story with us?
I'll take you back about 3 hours, and I think that'll probably hammer the point home most, which is had a lady come in with very advanced glaucoma in both eyes, very poor vision in both eyes. And I had asked her, are you planning on staying with us, or are you going to go back to the practice that sent you over? And she said, oh, nobody sent me over. I actually heard about you guys through a bingo tournament that I was involved in. I just heard about how great you guys are. And I thought that I would come and look. And my other doctor said that there's nothing to do for me anymore. And I thought I'd come here and see what you guys have to offer, because I'm not seeing well. I'm not doing well as far as a vision standpoint. And we did our whole history and our exam and our whole normal rigmarole that we do for all patients. And then we sat down and we talked, and I told her, you know what, I probably can't make your vision better, but what I can work with you with is to prevent it from getting worse. And we can work together for the next 20 or 30 years, however long you're going to be with us, to make sure that the vision you have now that you're able to still play bingo with is the same vision you're going to have in 30 years and be able to continue to have that. And it's patients like that want to just hear that, it's not the end of the road. And yes, they may have a very advanced disease, a very severe disease, but that you can work together. They just don't want to be abandoned, and they're scared of being abandoned. And I think that as a patient, to be told that, we're going to be there with you. It's not going to be easy, but we'll be there with you. And she loved it. And she's like, great, I'll be back in 3 months and we'll do whatever you need to do. And that was a patient I saw literally 3 hours ago.
Man, that's just a great story. I think we've got it. We've got it. Kirsten, anything we left out? That story makes it.
No, I just,
Yeah.
you know, of course, when I schedule new
Yeah.
patients, a lot of times they say on the phone, well, I'm a difficult case. I'm a unique case. But I think that can be said about everybody, like you said.
Absolutely.
There's no general way to treat everybody.
I think you're right. I mean, every case is obviously different, and patients will come in and say, I'm so difficult, I have this very difficult issue, I'm really unique. And I tell them, you are absolutely unique, but we've seen what you have and we're going to work with you to fix it. And I don't want them to feel like they're such an isolated case that no one's going to know what to do and they're alone in this. I think that it's important for them to know that, you know, especially in this practice where we're seeing a ton of patients a day, we have many years of experience, and fortunately we're able to pull in that experience, pull in Dr. Fellman, pull in Dr. Godfrey, all 5 of my partners, to pull into the same room and come up with an idea. And we'll all disagree, and then we'll come up with the right one for that patient. So yes, they're unique, and I'm sure their mother told them that they're unique, and they are special. But their glaucoma can be handled by us. And I think that, you know, there's tons of work being done here, a lot of research being done here. Maybe not at a bench with a pipette, but in our brains constantly. And I think that that's what makes a difference for these patients.